Good morning, good afternoon, good night, doctors, nurses, and pharmacists. I am DrChe, and today we will discuss some important writing tips. We will write one letter, we will discuss how to write and all the important things. And then I will show you model answer, means some parts of model answer we will write together, and I will also mark your letters at the end. So if you can hear me on Facebook, let me know. People on Facebook. Just
We can hear you, sir.
okay, thank you. And it's on Zoom. Okay, but just we okay, so if you people can share the session with other doctors, nurses, and pharmacists, that would be great. So your means your colleagues or your those who are preparing for it. Okay, so now let us start the session. So I have written, in the post ad, if you need case notes, please text me. So I have shared with those who asked me for the case notes. Okay, can you see my screen? The case notes on the screen?
Yeah.
Okay, thank you. Okay. Good evening. Okay. So as in the real exam, when you will get the case notes, so first of all, we need 5 minutes to read the case notes. Okay. In these 5 minutes, you cannot do anything, means you cannot write anything, you cannot underline anything. So these 5 minutes are just reading time. You cannot do anything. You cannot even pick the pencil, okay, in the real exam. So it is very important that you use these 5 minutes to, to think and to plan in your mind what the letter is about, how many visits are there, what type of letter it is, okay, what information could be relevant, what information could be irrelevant. So all of these things you need to keep in mind. So you are a doctor and nurse at this hospital, so write the task. So we will go to the task, okay, directly. So using information in the case notes, write a referral letter to this doctor. So immunologist, this hospital, and all of these things, okay. So still we don't know, but we can see that we need further assessment and vaccination of this patient. That is why we are writing this letter. So, but still we don't know the diagnosis. So we will go to the discharge plan. Sometimes in the plan or in the discharge plan, some important things are written, okay. So if you see the discharge plan, this is for community nurse, this is for occupational therapist, this is for social worker. As you are writing this letter, to whom you are writing this letter? Immunologist, okay? Immunologist, okay? So this is the work that immunologist will do. He will review the patient immunity within 1 week, and he will ensure vaccination against these bugs, okay, these bacteria, and then they will advise further prevention of infection. So these things will be done by immunologist. Okay, done. Then we need to start reading case notes from the start, okay? But very quickly, because you have 5 minutes to do all of these things. So this is date of birth, admission, discharge. You don't need to spend too much time here. Just see how many days, just almost 2 weeks. So social background, the patient. What is the problem with the voice? Anybody can hear me?
I can
Yes, sir,
hear you,
that's no
doctor.
problem.
Please.
Okay,
Okay, so I think your
we can
problem
hear.
from your side, connection, okay? Okay. So no, just quickly, no, we cannot decide what is relevant, what is irrelevant, okay? Because we don't know the diagnosis, we don't know what is happening, okay? How many visits are there? So we don't know anything. So then social background is, quickly, the manager lives in retired house, visited Ghana, visited family, okay? Smokes, drinks, BMI is okay. Allergies, these are vesiculolithotomy, acute cellulitis. This is the family history of this mother and father, okay? Done? Just quickly, okay? Even it did not take me 10 seconds to read it quickly. Then I need to see the dates of visits. Can anybody tell me why the dates of visits are very, very important? The dates. First, see the admission date. This is 10th of November 2022. And then these dates. Why these dates are important of these visits? Anybody can tell me? No? Nobody knows?
Sometime we need to be write a letter according to the chronological by date. If
Yeah,
something not
chronological order and
urgent.
order of
Yes.
importance. So these are two
Yeah.
things. Yes, that could be one thing. Yes, that could be important. Other thing is how much time is between each visit. Maybe some visit is 1 year ago, 6 months ago. Okay. And then maybe one visit is 3 months ago. So you need to see these things because sometimes some visits could be irrelevant if they're a long time ago and we don't know too much information. Because the information is not relevant. Okay. Okay. So now in this visit, if you see the admission date is 10th of November. So here is the same day, 10th of November. Patient comes with fever, chills. So why these are just extra information. Chills mean shaky hands. Okay, this is common term. So this is chills that you will use as you are in your letter. You will not use shaky hands because you are writing to a doctor. Okay, you will use chills. So all of these symptoms, okay, headache, nausea, vomiting, no bleeding, no rash, no neck stiffness. Examination is normal, except temperature. Blood pressure is almost okay, not any big issue. You can write if you wish. Okay, the pressure could be a little bit low. Yeah. So temperature, main thing is temperature. Okay, 39. Pulse even could be a little bit not a big problem, but main is temperature. Okay, and blood pressure a little bit low, pulse a little bit high, but not any big issue. Physical examination, you say yellow discoloration of skin. Abdominal examination shows tenderness and splenomegaly. Plus minus means almost 5 centimeter. This what this question mark mean? This question mark. What does this mean?
Suspected malaria.
Suspected.
Yeah, suspected. Okay, so you suspect malaria. Then you have ordered these investigations, and these investigations you have the results also. All are normal except test, malaria test, okay? Thick and thin blood films. These are positive, others are normal. Then what you have done, admission, antimalarial medication, paracetamol, this and that. So let's just read quickly, then why I will tell exactly in each how much you should write and how you should write. Okay. What happens during hospitalization in the next, okay, after 5 days, condition improved, antimalarial medication completed, no headache, no nausea, everything is normal. Only mild pain in right upper quadrant, and vitals are normal, just spleen is increased in size. And management is okay, just you have a discharge and advise to avoid sports and these things. Now, on this date, 20 of November, let me see that is 10/26. Okay. Okay. So patient was brought again. Okay. Now patient went home. Now brought again in the ambulance because patient falls while playing football. You advise to avoid sports and these things, but patient started playing. So, and as he fell, there was sudden pain in abdomen and there was lightheadedness. Okay, O2 saturation normal. Blood pressure is too low. Now 90/60. Pulse is too high, 120. So all of these two are important things in the examination. Investigations are normal and means blood investigations and clotting bleeding profile normal. Ultrasound, you have done ultrasound CT scan and you suspect there is some free fluid in the abdomen. Okay, thank you for likes on Facebook. So there are 14 people with us on Facebook and 53 with us on Zoom. So if you people want to join me on Zoom, sometimes it is very good to be a little bit interactive. You can talk with me. And Facebook, you are just, listening what is happening. So here you can participate also. So just text me so that I can add you in my WhatsApp groups to get. Okay. So then what happened? So you see some free fluid and possibly it was blood, okay, in abdomen, and there is some ruptured spleen. So only question mark is written with blood, not with other things, okay, possibly blood due to ruptured spleen. So then you have given fluids, morphine. So you have done the surgery, splenectomy. This is explanation, removal of spleen, because I knew that I will be using these case notes for nurses also, just to make it easy for you. But you will use splenectomy. You will not use removal of spleen because you are writing to a doctor or a nurse, okay? So this was the post-operative care that you have done. You have done change the dressing daily. A wound were observed for signs of infection. And this is today's date and patient is improved, no signs of infection on this and vitals normal. Discharge plan is daily dressing by community nurse and occupational therapist will do this and that. Social worker will do this and that and immunologist will do this, okay? Please mute is not good. Okay, so actually a little bit more, this letter is a little bit more for doctors than nurses, but overall, my purpose is to teach you, both of you, doctors and nurses, the language that you will use. The thing is not that you are writing to a doctor or nurse to whom you are writing. It's a little bit more like doctors. Basically, as I'm a doctor, so sometimes when I write case notes, I'm a little bit more inclined towards doctors things, but you should know how to write the history. The main thing is the language. Believe me, the main thing is the language. So if you know how to use the language, how to organize information, how to do this, how to do that, you can write any type of letter. Sometimes nurses also get letters like this, okay? One visit, two visit, second visit, third visit, fourth visit, and then write a discharge letter, write a, transfer letter like this, okay? So in the discharge plan, your main focus is the immunologist. You're not focusing on these things. So because you're writing this letter to immunologist, okay? Even you are doctor or nurse, that doesn't matter, no. Okay. So how many things we have here? Let me just open. So number one, we have purpose. Okay. Number two, we have first admission. You can call as 10th 11 visit, malaria. First discharge on 15/11, and then we have second visit on 20/11, then we have 26/11 discharge, then you have social or past medical history, then you have conclusion. So first of all, thank you for likes. There are a lot of likes on Facebook. Okay. And now I cannot share Zoom link because I'm the only person who does everything, because I need to reply all of you. I have to take the classes, free classes, paid classes, all the conversation that you do on WhatsApp is directly with me. Okay. So it's difficult to manage all the things. But just if you want, just get added in the WhatsApp group so that you can get the Zoom link. Okay. So now, because all of these visits are important, yes or not? Patient had malaria, then he got his spleen bigger. Okay. Then he fell, then he gets problem with internal bleeding, then a splenectomy was done, and then he was discharged. So all of these things are important. These 4 visits are important. We need to decide whether we need to write social history or past medical history or not. What do you think? Let us decide. Okay. So social background, his merit is not important. No. NHS manager is not important. No, is the problem is the only, a splenectomy, and we need a control of infection and vaccination from the reader. He lives where he lives in a retired house or not. This is not important. His family lives in Ghana, an African country. So he visited his family in October 2022, just some days before he got problem. So can anybody tell me, is it important to mention or not?
I think yes.
Yes,
Yes.
exactly. It is important.
Is
Exactly.
is important, yeah.
Yeah.
Anybody else? Anybody that
Mm,
who
I think it's
disagrees
not.
with us?
No, I think it's not important because the malaria is the old visit. Now they're more interested regarding the splenectomy. It's already diagnosed with malaria. No need for
Yeah,
what is the cause of the malaria.
people, you
From
need
where
to
it
you
came.
need to see the
Endemic.
situation. You need to see the situation of the patient. Okay. If I am GP, okay, and one of you, let us take any name, okay, Dr. Amira, okay. So Dr. Amira is the specialist, okay, let us say medicine specialist, okay. Okay. Now this is referral letter, okay, not discharge or. So patient came to me with fever, chills, okay, in my clinic, and now patient does not have cough, he has a headache, this and that. So what happens here? I am GP. I have, seen the patient, and as for example, if I'm in UK, so there is no malaria in UK, but if I take history, so there is a travel history. So after taking travel history, chills, fever, headache, I'm suspecting malaria, okay? Is my suspicion, okay? Now I'm sending this patient to the medical specialist. So now in this letter, do you think is important to mention travel history or not? No, I am GP and
Yes,
I'm referring
yes,
the
it's
patient to the hospital, to the medical specialist.
Travel history is important.
Now it is important, okay?
Important.
Yeah.
Yes, sir, that is important.
Now it is important, okay? Now let us see this condition. Patient was admitted in 1 week ago where it was suspicion of malaria that was confirmed with tests, okay? Okay, then patient, was diagnosed, was discharged, completed the treatment. So now giving this travel history to the reader, do you think is important? No.
No,
At
it's
this,
not important.
in this
No,
letter,
no.
in this letter,
Or not.
no. In this letter,
It's not
no. Yeah, if the same letter I change it, I'm writing to GP, I'm GP and I'm writing to medical specialist for the first time patient is coming, malaria is suspected, then I will not write the travel history. Then I must write the travel history, okay? But in this case, no. So this is how the things change according to the situation. There is no fixed rule. So you need to think medically what is important and what is not important. And that is why OET, the exam is better that doctors and nurses can teach you instead of English teachers. But just to be safe, we don't need to disagree with other people to get any problem.
Okay.
Okay. So cigarettes
No,
and these things are not important because this is not important. Cigarettes and drinks and these things. BMA is normal, don't need, okay. Open vesicular lithotomy, removal of stones of urine bladder in 2016 is important. No, not at all. Cellulitis, yes, is there an issue?
No.
Okay, so cellulitis in 2021 that was treated is not important. No. Okay, now family history of hypertension and mother has breast cancer. Any of these things are important, and father takes enalapril.
No.
No.
Why?
No.
Because he is already a malaria patient.
There is no, we don't need any,
No any combination with the
nor any
patient's
combination between
condition.
malaria and hypertension, these things, okay? If the same patient is, for example, referral letter and the patient is having bleeding in his brain, so then you think is important?
Yes, it's important then.
Yes.
Then is important, okay? So this is how the things change according to the situation, okay?
Yes.
Okay. So now, please mute. If there is background noise, mute, and then when you want to participate, you can unmute. Okay. Then first visit. Now, if you see, we have to write first visit, second visit. This is the main. What is the main visit here? When the patient falls. Okay. This is the main visit. Then this is discharge and discharge plan. So this we will not write anything because in this letter we don't need. Okay. So let us remove it. Okay. So then we have 4 visits and then we have conclusion and discharge plan. Okay. Now my question is, if you write each and everything in this letter, this visit, lot of symptoms, examination, physical examination, tests, treatment, then again, improvement, medication completed, examination, management, again what happened, then vitals, then investigation, then examination, then treatment, then post-operative care, then we have discharge plan, then we have here discharge date, then we have discharge plan. If you write each and everything, how many words you will write? Almost
Almost 400.
yeah, 400. Okay, above 400 almost. Okay, so now you need to before this is planning. Okay, you need to do these things quickly in the exam. You don't need to spend 1 hour doing this. Okay, just as it is teaching class, that is why I'm taking a little bit time so that you people can learn. Okay, so now you have 4 visits. Out of these 4 visits, what is the most important visit?
Fourth one.
Fall one.
This one, okay?
Fall one,
Yeah,
yes.
number 4. Yeah, number 4, okay? So this is, okay, I can see people are on Facebook are also with us. So please be with us. So Mr. Singh, Ali Lagari, Miss Rabia, Alina Malik. Okay, so thank you all of you. So I'm seeing your comments, okay? So next time if you want to attend, on Zoom, you can also get added in my WhatsApp groups. But no, just please be with us, okay? Okay, so no, this is the visit where we should write all the things, and discharge is just a short visit. And in these 2 visits, again, we need to give a little bit background history, okay? Because he will not understand if you start with he fell and he had, rupture of spleen. How a person can have rupture of spleen after falling? It's difficult, yeah? Just playing football and he falls and then he gets, rupture spleen. So it's not easy. The reason is because his spleen is already fragile due to, malaria. That is the reason. That is why these 2 visits are important. No, just I'm giving you a trick because I write my own samples. So I know how to make the case notes and these things. So now, if I change the same visit, same letter, and I start from 20 of November, okay? And before that, I write a visit, and 10 days ago, 10 days before he falls, he had flu, he had, uh, slight fever, a little bit cough. Please mute. Okay, so a little bit cough and flu and this and common cold was suspected, and the patient was given, Panadol and was advised to take rest. Even it could be respiratory infection, so you have given, what you can say, augmentin, whatever. Now my question is, if this is the case, first visit, then you have next visit of 20 of November, in which a patient falls and then he gets, a ruptured spleen. So then it is important or not? The first visit.
The first visit is important, so the patient has been
No,
diagnosed and
I'm not talking about this. I'm talking about if I change the first visit, patient is having common cold. So common cold has nothing to do with just ruptured spleen, okay? So then I will be adding one irrelevant visit at the start so that I can test the students, okay? So please be careful, okay? So now let us start how we will write the purpose. Then we need to see which type of letter it is. It is referral, urgent referral, discharge, or transfer letter. What kind of letter it is?
Referral. Discharge. Referral.
Is discharge plus referral, okay? So you are, yeah, it could be discharge. It is discharge. You are discharging the patient. At the same time, you are referring to another doctor, means a specialist, not to GP. If it is to GP, it is only discharge letter. So it would be like a transfer letter, like maybe. Okay, but overall, you can say a referral letter. Okay, so the thing is, you need to understand to how you are writing, what you need to write, all of these things. So another thing is, you need to decide whether you will use chronological order of importance.
chronological.
In this letter, chronological order. Why?
To show
So
about
the
the
history
background of
Because this is a
malaria.
discharge letter. Okay, so to understand the situation of the patient, you need to understand
Because sir, it is a referral letter, that's why not we are used on chronological.
Yeah, let us use for this letter transfer letter. Okay, okay. Because here to understand the situation completely, you need to go in a chronological order so that the reader can understand. Now, please, if there is some background noise, you people can mute. Otherwise, would mute all of you, and then I will be talking only, so nobody will participate. So it disturbs others, please. Okay. So now let us think. Let us think, okay? Again, in this letter, we will use chronological order. Now let us change the same scenario, same letter. I am GP, okay? A young man of 30 years comes to me. He falls while playing football, severe pain and abdomen, okay? Especially left upper quadrant. There is a tenderness, okay? And more on left upper quadrant. I suspect, okay? I suspect ruptured spleen, okay? Ruptured spleen. Patient is in shock. BP is 120, okay? Of 120 to 90. Now I need, this would be urgent referral or this would be normal referral if I'm at GP?
Urgent referral.
Urgent referral. So if this is urgent referral, so I will use the most important visit, this visit as the first visit, okay? After purpose, I will use this. I'm GP. I'm sending this patient to the hospital, okay? Patient falls, even could be the same history here. Okay, he had malaria on this date. On this date, patient came with malaria. On this date, patient was discharged. Today, patient comes to the GP with the same problem, okay? To the GP with the same problem, and with this BP and this. And then I remove this discharge date, okay? This. And here I just don't write the investigations. I just write BP was low and patient is in shock. No, I'm referring to the emergency department, this patient. No, the scenario will change, okay? Now it is urgent referral letter. So after purpose, you will write the most important visit. What is the most important visit?
Hold.
This one.
For
This one, okay?
second visit.
4, okay? So after purpose, I will write that today the patient came because he falls while playing football and then he has severe pain and here and there, okay? And BP is low. I am suspecting, shock. So ruptured spleen. So please review this patient. So it would be an urgent letter, okay? But here is discharge letter, okay? Transfer letter, discharge letter. Okay. So now let us come to our first visit, okay? So this is our first visit. So we have a lot of symptoms. If you make one or two sentences, all of them, so there will be a lot of words, okay? Then we have examination, then we have general physical examination, then we have suspicion of malaria, we have investigations, we have the treatment. And as you know, as we have decided that we don't need to write a lot about this visit, the reason is because if you write a lot, then your letter would be too long because the main visit is here. Okay, so now we will start. So always keep in mind, especially for nurses, when you get any letter, any visit of patient, so mostly we have some order in which we write, medical history. So first we write symptoms of the patient. Okay. If there are more, a lot of symptoms, you can divide into even 2 sentences. Otherwise, write 1 sentence. Then if there is some associated things, so you need to decide according to how many sentences you want to write. Okay. Then is the examination, means vitals and general physical examination. Then we write, if we have done any investigation, we will write investigation. Then if any suspected diagnosis or any diagnosis is given, it is important to mention, we will mention the diagnosis. Then we will mention the management. In management would be medical treatment and non-medical. So, okay, then treatment, okay. Treatment I will write as DTO, okay. So this is the order how we will write our paragraphs when there is any visit. But there would be slight changes according to the every situation. Okay. So now if you see here, so patient has fever, on and off. What word you can use instead of on and off? This is a little bit not
Intermittent.
intermittent. Okay, so this you should know as a doctor or nurse, you should know. Okay, but you can also write on and off. And chills, you will not write shaky hands because this is just, you know, a layman term. Okay, chills, even chills a layman also, but shaky hands a little bit more layman. Then
Tremor. We
abdominal
can
pain,
use tremor.
tremors. No, just not no. Tremors and chills are different things. Okay. Okay.
Excuse me,
Then we
sir.
will use. Yes, please.
Sir, we can change the language of the language means word of the card or not. We should write the same word, or we will
Okay.
change the word in the card as mentioned.
Okay. First of all, you need to see to whom you are writing. Okay. If you are writing to occupational therapist, okay, so you will not write means too complex language. Okay. There is one my video on YouTube, types of letters, so you can see that. So I have divided. This is my own classification. I divide letters into 3 types: medical professional, semi-medical, and non-medical professional. So if you're writing non-medical professional, like director of any place, okay, so you don't need to use medical terms, okay, just use simple language. So if you're writing to semi-medical, means like occupational therapist, physiotherapists, okay, like this, use a little bit less technical language. Even you can use terms. But if you're writing to doctor, nurse, use medical terms. But mostly in your exam, if they give, you know, the 2 things in bracket, use the, you know, the term that is according to the reader of the letter. Okay, so abdominal pain, headache, nausea, vomiting, duration of symptoms 4 days with no pain, and eyes, no bleeding, no rash, no stiffness. No, if you write each and everything, there would be very long sentence. Okay, it would look like this. Okay, on 10th of November, what is the name of the patient? Okay, Mr. Sharma. Mr. Sharma presented with fever, chills, abdominal pain. No, presented with on and off fever, chills, abdominal pain, headache, nausea, vomiting, duration of symptoms. Just 1 minute. Okay. So, by the way, nowadays I'm just thinking I should come with video because, you know, a little bit more interactive if you can see me also. But I don't know. I have been teaching OET more than 2 years, but I never had any courage to come with my video. But I will try in future. You know, little bit. You know, I'm a little bit, what you can say, introvert person. Anyway, okay. So then you will say and these symptoms lasted for 4 days and he had no pain of an eyes retroorbital pain. Okay, so now doctor who has asked me question, you have 2 things here. You have no pain at the back of eyes and you have retroorbital pain. So if you are writing to a doctor, which term you will use?
Retroorbital pain.
Yeah, doctor or
Retro.
nurse would be the same because you will use numerical. So you will retroorbital pain. Okay, no bleeding, no rash, no stiffness, neck stiffness. This visit for us is not too important because we just need to give a little bit what happened. Okay, just background. Do you think if you write each and everything, it would be long sentence? We don't need to mention there was, if it's something no, we don't need to mention. Okay, no bleeding, not mention. No rash, no need to mention. No stiffness, neck stiffness, no mention. Okay, so this last part after 4 days is not needed to write. Okay, Do you understand what is the strategy that we use when we write, case notes? It is very important for people to understand, because mostly you will not interact directly with the person who writes the case notes.
Excuse me, sir.
Yeah.
Excuse me, sir. Actually, you mean that if there is no any active complaint of the patient, it doesn't need to mention at all.
Yeah, because if you start, even it is important, even it is important medically, at that time was important, because you are just making differential diagnosis with meningitis and
It's a
these things, okay,
normal.
and dengue and these things. But now when you are writing letter and you know it is not the main visit, you just need to write the main thing, what were positive. So remove the negative. Okay. So my sentence would be like this. Initially on this date, okay. Let us write the date also. On this date, Mr. Sharma presented with intermittent fever. You can even write on and off, okay? Chills, abdominal pain. Even I can skip abdominal pain. You know why? Because in the examination there is tenderness, okay, in the right upper quadrant, so means it is positive there also. So even I can skip abdominal pain, but I will write, okay, because there are not a lot of symptoms, okay. Headache, nausea, vomiting. These symptoms lasted for 4 days. Okay, no, you don't need to write the negative things. Now, let us make it a little bit more. Okay, so as I told, in abdominal pain, even I can write later on. There is one more thing I can skip. Can anybody tell me what I can skip?
Sir, all these symptoms, like we can compress it like Mr. Sharma initially presented with the symptoms suggestive of malaria.
Yeah, very good. Okay, this is what people who told this.
Dr. Zainab.
That is very good. Okay, so when is your exam?
Sir, I haven't decided yet.
Okay, so that is good. Okay, because you are quite new. Okay, for this exam. This is good question, because some people, even in the real, when I mark your letters, believe me, I have marked thousands of letters. Okay, so I know what common mistake you make. Okay, so just in a hurry, because you want to make it concise and you don't want to write a lot of symptoms, you will write, okay, on this date, Mr. Sharma presented with signs and symptoms suggestive of malaria. Okay, and his thick and thin blood tests were positive, and he was started on anti-malarial medication. So you want to make it very concise. But this is not good for your letter to get good score and write, appropriate score, okay? Because this language is for purpose. This language is not for body paragraphs, okay? Dr. Zana. So here you need to write the symptoms. Even you can be a little bit more specific. For example, nausea and vomiting. What is the difference between nausea and vomiting? You can skip nausea. It's not important too much, okay? Even without nausea, you can understand what is happening, okay? So I skipped nausea, okay? No, a little bit less, okay? Fever, chills, abdominal pain, headache, and vomiting. Do you understand what I want to say? Yes or no?
Yes.
Okay. Now we have one more problem here. These symptoms lasted for 4 days. These symptoms lasted for 4 days.
Which was lasted for 4 days.
Okay, this is one way. Which was no. If it is which, because there are more than one symptom. So was is wrong because we're referring back to more than one. Okay.
Which were?
Which were even which lasted, as Ms. Tatiana has written in the Facebook comments. So which lasted is okay. Lasted it. No, which lasted for 4 days. It means she had symptoms. No, she had these symptoms for 4 days. It's not good. Which lasted for 4 days. It means total duration of these symptoms is 4 days. No, is almost wrong. Okay, because patient is still having symptoms and patient will still continue having these symptoms when he will be admitted. Okay, technically it is not good. Okay, there is one good way to write it. Anybody knows?
That with 4 days history
Within
of
4 days.
Yeah, very good. Who told me 4-day history of?
Shivanti.
With the
Jivanti?
4-day
Wow,
history of
please, Ms.
intent to
Jivanti.
discharge.
You are VIP hybrid course student, so you have written a lot of letters with me. You will know this, okay? Okay.
Okay, sir.
So, but other people also, okay, Ms. Sharma present. Okay, Ms. Jivanti, just to for other people, just for motivation. So, how many letters you have written so far in the course?
Almost, I think, 16, 17,
17. And but in the course we have 14 letters.
14, yeah.
In the course we have 14 letters.
Yes, sir. Then you
So
gave
are
me
you paying
another, I
other
paid
file?
for, no, I paid only for 14 letters. Then after I finished it, you gave me another file.
File to write more letters, but without any extra charges because I want my students to pass the exam and not only earning money. Okay, because
Yes,
if
sir.
you write only 14 letters, then I think you will not be ready for your exam. That is why I keep helping my students. Okay, so by the way, nowadays we have 50% discount at the new year and these things. Okay, and Ms. Sharma presented with we will write with a 4-day history of. Okay, no, it's very good letter. Okay, good sentence. On this day, Ms. Sharma presented with a 4-day history of intermittent fever, chills, abdominal pain, headache, and vomiting. So here we need and. Okay, and vomiting. Okay, any questions so far? No, good. So now in the examination,
Excuse me, I have one
yes,
question, please.
yes, please.
Is there should be article before fever or no?
Before fever,
And
no, because history of intermittent fever.
we shouldn't write
Ah,
an
history
intermittent fever.
you can use, okay, you can use, but without
Okay,
article is also okay.
okay, thank you.
Both are okay.
Also, sir, is it necessary to put dash after four day, like 4 dash
Yeah,
days?
is important because if you don't write, it's wrong. Okay, just like we use in the
Thank you.
purple for 33-year-old man. Okay, so there are some rules for that. So in some day we can discuss about that also, but if we will use. Okay, now you have the examination. Okay, in examination the important thing is temperature. BP I can even skip because here that is not important, but you can also write if you wish. When I wrote this letter, it became very long, so I had to make it very concise. Okay, so blood pressure, temperature, zero discoloration of skin and eyes is important, tenderness is important, and splenomegaly is important. Then you will write the her blood investigations were normal except for thick and thin blood films. Okay, or her thick and thin blood film for positive for malaria. You can even skip negative things, and she was commenced on this and that. Okay, so let us save your time and let me show you from the model answer how I have written this part. Okay, Okay, now I will tell you that some important things here. Okay, I have written this letter. Then when I counted my words, it was very long. Okay, then I have to make, because I was writing a model answer, means that would be helpful for all of you. That is why if you write a lot of things in this visit, your letter will be definitely long. Okay, so okay, you have already, this is temperature. Okay, and you have already written fever. Do you think if you skip this temperature in vitals, is it acceptable? What do you think?
Yes, I think
Yes, I think yes.
Yes,
Yes.
accepted, because you already written fever here. No, having blood pressure of 100 by 70 is any big issue?
No.
Not any big issue. Okay. First of all, this is, just a background visit, not the main visit. If it was the main visit, then it could be important because patient is vomiting, that little bit low pressure. That is okay. But here, thus we need to give that he was having malaria at that time. Our focus is not on blood pressure and these things. Okay? Even it is not too low. Okay, so we will skip blood pressure. So I have skipped blood pressure. I have skipped, temperature. Temperature was already mentioned. Blood pressure was not any big issue. Okay, so I have written, but yellow discoloration of skin and eyes is important because malaria and hemolysis and these things. His examination revealed yellow discoloration of his skin and eyes and tenderness in the lower, it should be upper, no, left upper quadrant of his abdomen and splenomegaly. Even I have not mentioned how much is the splenomegaly this. Okay, so this is the examination, important thing. Malaria was confirmed on thick and thin films. So I'm writing diagnosis with the test. You people can see, even you can think I am not using any high level of English, but I am making things very concise and easy. Okay, so Sharover Hussain Shawan has joined us. Thank you on Facebook. People can see what you will write is his blood investigations were normal, except his thick and thin blood films were film test was positive. So then you will write malaria was suspected, a patient was admitted and was commenced on antimalarial medication, paracetamol, this and that. This is how you will write. Okay. Malaria was confirmed on thick and thin blood films and he was commenced on antimalarial medication. I'm not writing. Is it important note paracetamol that was given at that time and drink plenty of fluids and rest and these things? What do you think?
I think no.
No, the main thing is malaria. No, done with this. Am I using any high level of English here? Any high level of English? Any high level of English? No. Believe me, if you write the same letter that I have written in the real exam, you will get above 400. Even I'm not using any high level of English. Okay, so next. So what most of you will write a separate visit on this date. The patient condition was improved. His antimalarial medication was completed. He had no nausea, vomiting, this and that, and mild pain was, in the lower abdomen and this, but he still has, his spleen was 7 centimeter. Patient was discharged and review was advised and this and that. But what do you think? What is important in this visit? What is important? The only
Size
thing
of
is,
spleen.
no,
Size of
the
spleen.
patient was improved. The patient was improved and was discharged. Okay, you can even write size of spleen a little bit, but this is the main thing. We don't need to go into too much details of these things. Okay, because you have a lot of things to write. Okay,
Patient progress is improved.
Yeah, okay. So after 5 days of treatment, you can see this is just at the end of the same paragraph. We're not writing a separate paragraph. After 5 days of treatment, his condition was improved and was discharged home. One complete paragraph in one sentence. Because I don't know, this is not important. The main important thing is the next visit, okay? No, next visit you will write as it is because this is the most important visit. On this date, patient came because he fell while playing, uh, football, and there was sudden onset pain in abdomen and lightheadedness. His examination revealed a low blood pressure and heart rate and blood pressure is important in examination. Investigations were normal except for his ultrasound and CT scan revealed, ruptured spleen with free liquid in the abdomen. Okay, so then he was he was transfused 3 units of blood and splenectomy was done. Okay, so then so this is you can write easily. Okay, this today's visit you can also write this today's better and then be discharged in this. No, the problem with discharge plan. The problem with discharge plan is you have 1, 2, 3, 4 things, and all of these things are for different people. Okay, first is for nurses, second is for occupational therapist, fourth is what social worker will do, and the fourth is what immunologist will do. Who is your reader?
Immunologist.
Immunologist.
Do you think
Immunologist.
giving a lot of information that you have asked the community nurse to change the dressing daily, and I have asked the occupational therapist to come and review the workplace, and I have asked the social worker to come and help her in daily activities. Is it important for immunologist?
No.
No.
No. Okay. The same letter you are writing to a community nurse or community doctor, okay, means GP or community nurse. Okay, so do you think all of these things are important to mention for the GP or not?
All are important.
Only the first one?
All are important
Hmm.
because GP should know, because GP is like the father of patient. Okay. Yeah, okay. The father need to be careful about school, he need to be careful about sleeping, he need to be careful about clothing, everything, each and everything. So nurse can do the changes in dressing, occupational therapist will do workplace assessment, social worker will do this, but GP should know all of these things. Okay, our community nurse should also. For community nurse, mainly the focus would be this one if you write into community nurse. Okay, but GP would be all the four things. Okay, so now I think we are bored. Okay, we should go to your letters. Yes. Okay, Dr. Sita is there. Dr. Hasita.
Yes, I'm here.
Okay, when is your exam?
14th of January.
Okay, let us. I think your letter will be good because you have only 2 weeks. So 196 words. So in first step is pass. Okay, greeting is okay. I'm writing to refer Mr. Sharma, a 49-year-old NHS manager who was underwent. Why were you using passive voice? A splenectomy following a traumatic splenic rupture. Okay, so if we want to use this in the same sentence for further assessment and vaccination, you should use comma here. Okay.
Okay.
Let me tell you why. Because many of you keep making this mistake, but you people don't know why. Doctor, can you read your sentence now?
I'm writing this to refer Mr. Sharma for further assessment and vaccination.
Okay, this is your main sentence. What is this? What is this?
The main sentence.
Your main sentence,
Purpose.
okay? No, just I'm talking about grammar, main sentence. Okay, now you want to add something extra in this, in the same sentence, okay?
Yes.
You want to add something extra.
Yeah.
For example,
Diagnosis.
diagnosis, age, okay, like this. So you need to separate this from the main sentence with commas.
Yeah.
Do you understand? So you need to use one comma before the new thing and one comma after new thing, okay? So here new thing is, it starts from here. So you need one comma here also. So this is, you know, there are different classes and there are different rules, but you should know the main thing, okay? Initially on this estimation mark. So here it is wrong. Why it is wrong? Was admitted? Was underwent. Is was admitted is okay because who is admitting? Dr. You, okay? But here,
okay.
Was underwent is wrong, okay? Who underwent?
Mr. Sharma.
Underwent, okay? Mr. Murphy, who
yes,
underwent? Explaining with you, okay? Initially on this
Okay.
mission was admitted. Here it is okay to use this, okay? Mission was admitted because it was by you, okay? With on and off fever, chills, nausea, and vomiting. Had please don't use this and because you are using a list, okay? Nausea, comma, vomiting, okay? Headache and abdominal pain for 4 days duration. It looks very strange for 4 days duration. Looks strange or not, believe me.
Yeah.
Be honest. It does not look very good, okay? Was admitted with a 4-day history of on and off this and that, okay? Would look very brilliant, okay? On examination, he had, I think I was using she or he in my Mr. Shimano, I am using Mr.
Yeah.
Okay. For examination, he had elevated body temperature. Okay. It means you are writing to a baby. You're writing to a baby, yeah? Elevated temperature.
Yeah.
This is a layman term, okay?
Okay. Yeah.
But you're writing to a immunologist, okay? Please be careful. We'll get angry. Because we'll say you don't know. You mean that I don't know what is fever. Okay. So this is layman term. It is wrong to use here. Okay. Even grammatically it is okay. So just give me 1 minute. I need to see a patient. I'm coming back. Okay. Please don't leave. Just I'm coming. Okay.
Okay.
Hello, everyone. How many doctors are there who are going to appear on 14 January? Please let me know.
Okay, thank you. So, can you hear me, doctor?
Yes.
Please just write fever, don't make it difficult, okay? Write temperature. Icterus is okay, instead of just using, yellow discoloration, this icterus is okay. And tachycardia with tenderness in left upper quadrant and splenomegaly of 5 centimeter, very good. Subsequently, his thick and thin films were positive for malaria, and he was started on anti-malaria medication. Okay, you don't need this, you don't just coma, okay, like this, coma. Following this treatment for 5 days, his condition was improved, but had, okay, who had? His condition had mild. What is the subject of this? But had.
He had.
You can skip the subject if you have written the same subject in the previous part, okay? But in the previous part, you are not writing him, you are writing his condition.
Yes.
So it's wrong here, okay? You need to use here the subject, okay? He had, okay? Mild right upper quadrant pain and splenomegaly for 7 minutes, okay? Very short with a follow-up plan. Good, okay? Very conciseness is very good, okay? On this day, Mr. Sharma was brought by an ambulance after an accidental fall, okay? While playing, you don't need this comma, okay? While playing football, he had abdominal pain with increasing severity and dizziness, rapid sleep, and free liquid in the abdomen. Was is wrong because you are writing mentioning two things. Spleen, yeah, is wrong, okay? Diagnosed by CT scan, this splenectomy was performed and following a transfusion of 3 units of blood. Okay, Mr. Sharma is being discharged today. Please review him, Mr. Sharma. Okay, review him within 1 week to administer his him. Okay, pneumococcal, meningococcal, and hemophilia vaccines, and to educate him about prevention of infections. Overall, is good, doctor. You will get a B grade. But please, there are mistakes. Be careful, okay?
Yes. Thank you.
So Samina or Samima, something like that. Are you there? No? Is there? I think is a nurse. Are you there? No? Okay. Rafia Mahmouda is there? Rafia Mahmouda is there? No? Rafia Mahmouda is there? No? Muzammil Sultana is there? No? I think I got some problems here. Okay. Okay. So please, I will not mark letters, after the class because I cannot. Just if you send me letters, then you need to join the class to get your letter marked, okay? So Muzammal Sultan is not there. Miss Samina is not there. Rafia Mahmood is not there. So Muwese? No? Anybody can hear me? Maybe some connection
Yes,
problem.
sir.
Okay.
No, sir. No, sir. Yes, sir. We are
Okay.
hearing you.
So Karen say, are you there? You there?
Yes. Yes.
Okay. So Dr. Rafia is present there also. Okay. So Dr. Rafia, I will mark, okay? Rafia Mahmood. Just let me know, finish this. Is a nurse or doctor? Nurse. Okay, very good. Okay. So thank you for seeing Mr. Sujit. No, we will use surname, Mr. Sharma. Okay, we need comma here, comma, who was in our care at Newtown Hospital for treatment of malaria and splenectomy. If you write a treatment of malaria and you will write, uh, rupture spleen because you want to write the diagnosis. Okay, so or you can write who was at our hospital for treatment of malaria and underwent splenectomy. You can use underwent here. He needs
Okay.
a little bit, less formal language. You need to use polite. Okay, he would require your special assistance after. What is this? Immunologist. You are writing to immunologist. You don't need to mention the immunologist. Okay.
Okay.
So you can write your further care about immunization would be highly appreciated like this. Okay. I know it's a little bit difficult for nurses, but still you can see easily if you know the rule, how to write the purpose in these things. While we to Newtown Hospital, we should write capital, okay, with complaints of fever, chills, okay, headache, abdominal pain, vomiting. This no and nausea for 4 days. Other ways, okay, for 4 days with the temperature of this. So temperature is does not fit very well. You have already written here fever. Then again, in the same sentence, you are writing temperature of this. You don't need to use the name of the patient again, just he, okay? He presented
Okay.
again, there no need of presented again. Because you already written here, admitted, presented is same thing. So here don't use the name of the patient, so just he, okay? He had yellow discoloration of skin and eyes on examination, and abdominal terminal was filled, okay, was felt, was found on the upper quadrant, okay? Other investigations were done. So this is not needed, investigation were done. This is not needed, okay? They were
Okay.
done, but done. You don't need, okay? CT scan showed an increase in the size of spleen of about 5 centimeters, thick and thin. Thick, okay? Thin blood films tests were positive, okay? Were positive, were done, no. Were positive for malaria and typhoid is negative. You don't need to mention it, okay?
Okay.
Mr. Yud was put on antimalarial. You need to mention in the same visit here, okay? In the same here, okay? No, it is separate.
Okay.
During the second visit, Mr. Yud had no complaint apart from enlarged spleen of this in size, and he was advised to not to do strenuous activities. However, on this date, Mr. was brought to emergency department, reportedly having falls. Okay, so what you need to do is take a picture, a screenshot of model answer, please.
Okay.
Yes, please.
I've done so.
Done. Okay, so you will rewrite this letter and you will send me again. Okay,
Okay, I'll do so.
this offer is only for you. Okay, not other people start sending me letters because I need to do a lot of things. I cannot mark each and every letter
Okay, okay.
because you need a lot of improvement. When is your exam?
Okay, thank you. But
When is
it's
your
in
exam?
March.
In
March
March.
11th.
Okay, you have enough time,
Yes.
but just improve. Okay,
Okay.
Dr.
Thank
Rafia, you need to write the date here. Okay, not at the start, please. Okay, and here you don't need to leave blank line. Okay, this letter is being written to refer. This is not needed, just you OET has typical style to start. Okay, I'm writing to refer. Thank you for seeing. Thank you for accepting. So please use typical. Okay, you can watch my YouTube video in which I have explained how to write purpose. 49-year-old. So here we need hyphens. I think you are new. I think you are new in writing letters. Gentleman, just write man, okay, who is recuperating from the splenectomy. Okay, it can be okay, recuperating from the splenectomy. It requires, we would require because we need to use polite language, okay? Further somebody following his discharge today. Okay, initially on this day, Mr. Sharma, you can say you have written each and everything in the same paragraph, I think so. Each and everything in the same paragraph. Was brought to our hospital due to severe pain in his abdomen. Upon assessment, his vital signs were normal without elevated pulse rate. This is not needed without elevated pulse rate. Okay, these are normal, so normal. We don't need this. Okay, during hospitalization, certain blood tests were done which were normal. Your English is not bad, but I think you are quite new in OET. Yeah. Okay. So when is your exam, Dr. Rafia? So you are a nurse. Okay, you are a nurse. Okay. Apart from that, he was underwent. So is wrong. The mistake that the doctor has made. Ultrasound and CT scan is wrong. He was underwent ultrasound and CT scan is wrong. Okay. Just show directly write his ultrasound and CT scan revealed this and that. Okay. Okay. For liquid in the small language, he was treated with IV fluids, painkiller. You are writing to a doctor. Painkillers, no. 3 units of blood following the splenectomy. Ms. Sharma's surgical site was managed with daily dressing, and there was no sign of. It is usually written in plural. There were no signs of infection. Okay. For today's review, Ms. Sharma's condition has improved. His vital signs are normal on assessment. Vital signs were normal. In view of the above, it would be greatly appreciated if you could review Ms. Sharma's immunity condition within 1 week and ensure his vaccination is scheduled. Kindly arrange the daily dressing. Change. Okay. So this is not the reader will do. Okay. I know you are a nurse. It is difficult letter for you, but still there are nurses that who have written good letter, the same letter. Okay. So the same thing for you, Miss Rafia. Take picture of screenshot of model answer, please. You will write this letter again and you will send me to remark because this is C grade for me. Let me know when you have taken the screenshot of model answer, please. Write down something in the chat. Okay. So you need improvement. So Dr. Sama is there? Dr. Sama, Nahid is there? Dr. Sama? I can see someone. Yeah, okay. You are there. Maybe you cannot talk, but you can listen to us. Okay.
DrChe is here, sir.
Yeah,
He's
okay.
here.
Okay. Just I'm marking your letter, Dr. Sama, but he cannot talk with us. Maybe she is on duty or something. I'm writing to refer Miss Sharma, a 49-year-old, Mr. Sharma, a 49-year-old male who is being discharged today after splenectomy and requires relevant vaccinations and further assessment. Okay. Instead of requires, you can add would require. Your purpose is okay, but it's not typical OET style. Okay. We can improve. You people can see, I knew that some people will make this mistake. Is it important this for this letter?
No, sir.
Not at all. Not at all. Initially on this stage. So now even I don't read your next letter. So it is C plus for me. Okay. Even I don't need to read your next part. Even it is perfect. Next part, your score would be C plus. Okay. Because you have written irrelevant information. Initially on this date, we need this one small, maybe typing mistake. Ms. Sharma presented with a 4-day history of abdominal pain, nausea, vomiting, and headache. There was tenderness in the left upper quadrant with splenomegaly of almost. You can plus minus. No, please don't use plus minus. You write almost. Okay. 5 centimeter in size. Thin blood film was positive for malaria. As he was commenced on anti-malaria medication. You people can see these two sentences. What is the problem with these two sentences?
We just mentioned that he was positive for malaria and comments on anti-malaria medication, anti-malaria drugs.
No, it is okay. There is some grammatical issue. Anybody else, please? So just let us give chance to other people to participate also. Anybody else wants to participate?
Yeah, we can use for with was positive with past symbol for. I think, yeah.
But there is one main issue. This is the small thing. The one main issue. What type of these two sentences are?
For diagnosis and medication.
No, types of sentences, please. These are simple sentences. Simple. This is simple. And the second one is simple. Please mute. If you have background noise, please mute. Okay. So these are two simple sentences. Thin blood film was positive for malaria. Full stop. It's just like this. I get up early in the morning. Full stop. I do my breakfast at 8 a.m. Full stop. I go to school. Full stop. Okay. I study mathematics. Full stop. It's like simple sentences. So these are two simple sentences. You can join them together with and. Okay. And then it would be a compound sentence because these two are relevant things, relevant to each other because here test was positive for malaria, then he was commenced on anti-malarial medication. So you can join them together. Okay. Was brought to emergency department with an ambulance after a sudden increase in pain. Okay, increased no. A sudden increased pain is okay in the abdomen with dizziness as well. Even grammatically it is okay, but not typical style. Okay, he was vitally stable except that blood pressure. His blood pressure was which was no need of which blood pressure was 90/60 as ultrasound CT scan of abdomen revealed free fluid in the abdomen and ruptured spleen. Okay, he was admitted and splenectomy was done. Sharma is ready for discharge. Veterinary social worker has arranged for daily activities and daily dressing of wound. Okay, I can accept it, no problem. But it's not the main issue. Okay, an occupational therapist just typing mistake here will review home and his workplace for any changes needed. I appreciate if you could review within 1 week for this and that. Okay. Okay. Overall, your English is good, Dr. Sama. Excellent. But you need improvement. Okay. Please don't write irrelevant information. But overall, your English is good. Just you need practice to get your required score. Okay. So anybody has any questions? Just one last thing. So nowadays we have a 50% discount on our writing course. You will get a lot of letters marked by myself. You will get model answers and 50% discount is available. Any question, please? Any question?
Yes, sir.
Yes, please.
Sir, there's one thing called purpose. For example, thank you for seeing Mr. Sharma, who has recently your further assessment and all that. And another thing is called expanded purpose. So I'm confused. Is it mandatory to write expanded purpose right after main purpose, or should we start with the first or most important visit?
No, we don't need to expand. We don't need to expand the purpose in the next paragraph. It's not important. Okay. You need to write the purpose. You write the visits. Okay.
Okay.
You will expand the purpose throughout your letter because this is your heading. Okay. This is your heading, just like like headings in the newspaper. So they write the main heading. So throughout the explanation, they're writing the details of the same thing. Okay. So you are expanding this. So throughout your letter, you are expanding this. This
so
part.
We start with our visits right after that.
Visits, yeah.
Okay, sir. Thank
Some
you.
people write social history also. It depends according to the type of letter, which type of letter it is, and according to the situation. Any other question?
Sir. Thank you.
Okay, thank you. So when there would be our next free class, please invite at least 1 or 2 students from means you will have some colleagues or some friends who are preparing for the same exam. So please invite them for the free class. And if any of you wants to join our course with 50% discount, so can join. Thank you so much, all of you.